past midnight. You have just peacefully closed your eyes after a long day of caring for a newborn that is roughly the size of your hand. Just as you start to doze off from reality, your baby's heart monitor starts to kick in, sounding like fire alarms to your ears. You race out of bed into the crib, already knowing what's in store. Your baby isn't breathing. This isn't the first time that this has happened, and most certainly won't be your last. This was the average night for my parents and many parents around the world that are dealing with premature babies. Today, I'm going to be talking to you about premature babies. The reason as to why I'm talking about these babies is because I myself was a preemie baby. Specifically, I'm going to be talking about the characteristics that are associated with premature babies, how to take care for premature babies, and the complications that arise when dealing with premature babies. To begin, premature babies have very distinct physical features. They weigh around 5 pounds, which is roughly 2.26 kilograms. Normal babies, in comparison, weigh around 7 pounds. According to mayoclinic.org, preemie babies have small bodies and disproportionately large heads. They are sharper looking in features and have less round bodies. They have fine hair that covers the majority of their body, and their body temperature is often low because of the little body fat. A baby that is born around 28 weeks is approximately 2 pounds and 3 ounces. A baby that is born around 24 weeks weighs approximately 1 pound and 5 ounces. I myself was born at 26 weeks and I weighed 1 pound and 13 ounces. Now that you know some characteristics that are associated with premature babies, such as their weights, skin conditions, and body proportions, we will now talk about how to take care for a premature baby. Premature babies have underdeveloped immune, digestive systems, lungs, and different skin conditions. AmericanPregnancy.org states that NICUs are the home for preemie babies for their first few months of life. They have the proper equipment, staff, and tools that are needed to take care of such a small individual. A study published in March of 2020 states that 99% of infants that are born at 28 weeks or older are released from the hospital by their expected delivery date. The same study published that 75% of infants that are born under 28 weeks have been released by their expected delivery date. Now, when it comes to taking care of premature babies at home, there are some precautions that need to be taken. Limits with family members and outsiders must be kept to a minimum because of the baby's weakened immune system. According to mayoclinic.org, apnea monitors and heart monitors are often used for the first few months of the baby's life at home. Latching is very difficult for premature babies, which is why they need the extra nutrients from breastfeeding or from bottles. Yearly eye doctor exams and health checkups are in order and are required for premature babies. This is a picture of me when I was in the NICU when I was born, 3 months early. Taking care of newborns consists of many steps that need to be taken with special care and precautions. Next, we are going to jump into the complications that are associated with premature babies. According to mayoclinic.org, heart, brain, and breathing problems are some of the short-term complications that arise. Trouble breathing because of their undeveloped respiratory systems are known to happen. Heart problems cause heart murmurs, heart diseases, heart failures, and other complications. The earlier that a baby is born, the more at risk that it is for internal brain bleeding. Most hemorrhages in newborns are mild and resolve fairly quickly. As marchofdimes.org states, vision, hearing, and dental problems are some of the long-term symptoms that arise. Dental problems include delayed growth in their teeth, discoloration of the teeth, and often crooked teeth. Premature babies require a great deal of love and attention and extra care, from their teeny bodies to their barely beating hearts. Today, we have discussed what it takes to care for a premature baby, the complications that are associated with premature babies, and the characteristics that define premature babies. Thank you.